Yeah, so a lot of people come into my office and they have a family history of diabetes. They may have prediabetes or insulin resistance themselves, and they wonder, what is it that I can do? The first place to look is really our nutrition. Are you eating foods that are likely to make insulin resistance or prediabetes worse? Unfortunately, we live in a food environment where there is a lot of processed food around us, and the more processed our foods are, typically the more insulin and blood sugar issues we're going to see, sometimes also with cholesterol, which can be correlated with blood sugars. So, if people are eating what's called the standard American diet that has a lot of processed foods and especially a lot of refined carbohydrates like bread, pasta, cookies, treats, a lot of things that are very easily broken down in the body and create a big blood sugar rush that leads to a lot of insulin release. When that is the standard diet that people are consuming, that is the first place to look. Can I reduce processed foods? Can I increase naturally fiber-rich foods such as fruits, vegetables, beans, nuts, seeds, which will really help to slow down that blood sugar response, as well as to help lipids, to help gut health, right? There's a lot of benefits that come from eating that way. There's a lot of attention focused around protein intake. And that one I would say is important, but it's also more complicated than that. If people go and increase their animal protein a lot, so if they just hear the message, I have to increase my protein, I have to get 30, 40, 50 grams per meal multiple times a day, they're often turning to a really high animal protein diet. And unfortunately, for many people, that can sometimes worsen insulin resistance and worsen their cholesterol because of the impact of saturated fat. That's too much usually for the body, even if we are eating the healthier choices that we've said for a long time of more chicken and fish and less beef. Our body really doesn't see a huge difference between those different animal proteins. And so when I'm talking with people, I'm really trying to push forth that we don't need those crazy high levels of protein intake in order to be healthy. A lot of that comes out of the sort of weightlifting culture that has really pushed really high levels of protein. It's not really health focused, it's really about muscle mass. But when we are paying attention to protein, we want to get some plant-based protein in the mix there. So again, your beans, your nuts, your seeds, tofu, soy curls, products like that that are going to give us some protein and some fiber, that's going to be a really healthy way to eat for people. So nutrition is one thing. Sometimes people are already eating, a diet that looks that way. They are already exercising, which is really important for skeletal muscle insulin resistance. When they are already doing those right things, then we might be looking at adding medication. And this is something that took me quite a while to wrap my brain around. Why would we use a diabetes medication to prevent diabetes when we don't yet have diabetes? The thing is that diabetes is such an inflammatory condition, and it really is an underlying factor in a lot of heart disease, in a lot of strokes, and a lot of kidney disease, and a lot of liver disease. That if we can prevent diabetes, the things that will often prevent diabetes are also going to be preventative against those other conditions. It's not simply about our blood sugars, it's really about our overall health. So sometimes we might be adding a medication like metformin, which is a very old diabetes medication. Sometimes we might be adding Jardians, which is a newer medication that helps to increase our sugar excretion through the kidneys. Sometimes we're using our Ozempic-like medications, Wegovy and Zepbound, which have a diabetes version, but are also helpful in the treatment of obesity. And they work on that blood sugar and insulin pathway. And so when we have a family history of diabetes, we are more genetically primed to get it than somebody who doesn't have that family history. And so I think it takes a little extra attention. But again, it matters on where do we want to start. Sometimes people will need some medication support, especially if they really struggle with emotional eating, stress eating, food addiction. They're probably going to need more support than somebody who is, sort of taking the right actions, but it's not producing the results. That person might respond better to metformin and Jardians or empagliflozin. I can't even say the word. The generic version of Jardians. That will be a really helpful pathway. But family history of diabetes is super important. It doesn't mean that we can't get diabetes if we don't have a family history, because of course we see that too. But family history is really a prime risk factor.